Healthcare informatics is a field that combines knowledge from fields such as healthcare, computer, information, and cognitive sciences in order to build and assist in the management of healthcare information systems. It has a variety of uses, and one of the ones that we'll be covering today is how it allows healthcare staff to quickly and safely access pertinent information on their patients throughout the healthcare institution and beyond. With the pace that this field has been evolving, not all healthcare professionals or providers have chosen to adopt the new technology right away, creating a sort of gap that exists between new technology and the processes in clinical settings. So to address this, in 2009, the President of the United States signed into law the Health Information and Technology for Economic Clinical Health Act, which financially incentivizes the use of electronic healthcare records, giving medical professionals the ability to access pertinent information right at the tip of their fingers on any patients that they may be helping.
Hi, my name is Megan, and I will be talking about the managerial implications and policy implications that arise from health informatics. So to start off with the managerial implications, this usually consists of the communication within our society, whether it's verbal, physical, or electronic. So people in these positions do their best to utilize things like fax, email, telephone to aid healthcare workers and for their time management. So the managerial role also consists of interpreting data and decision making and things like admin. This is like payroll or like material control, things like that. EHR or electronic health records also plays a large role in the meaningful use and the organization of it all. So meaningful use is a program in place that encourages the use of electronic health records by rewarding them for using it or penalizing them for not using electronic health records. So without managers, healthcare organizations will not be able to thrive. And then the last implication is policy implication, which is data used for policymaking in public health issues. So EHRs are essential because policymakers need to be able to understand the data and interpret it so they can make sound judgments in making new laws. It also relates to following the rules and abiding by HIPAA in the growing age of technology. So more advanced technology means newer rules and increased liability that needs to be taken into consideration.
Since the major growth of technology in today's society, medicine has gradually evolved by developing new methods to incorporate technology to provide more efficient, effective healthcare treatments to patients. A recent study at Salford Royal Hospital studied how data collection through an app developed by the University of Manchester improved doctors' consultations. Patients recorded their symptoms in real time and the effect it had on their daily life, which enabled them to recall symptoms more easily to provide a more holistic and thorough description of what they were feeling and how these symptoms made them feel. By integrating the patient's emotion into the consultation, clinicians empathize and are therefore reminded to treat as a human rather than a subject. An ongoing project similar to Salford's is being developed by companies living with and the Royal United's Hospital, which targets rheumatoid arthritis patients to record flare-ups, then input data into an additional machine to decipher the most appropriate remedy. Likewise, pharmaceutical companies have been utilizing technology to monitor their patients' medication schedules, which assist in ensuring patients maximize their treatment plans to improve their health. It is evident that the incorporation of technology and using it to its full potential will improve not only the patient's treatment, but their overall relationship with medical professionals.
In the second article, we learn about an app where patients input their symptoms every day for 3 months and the impact on their lives was recorded. And researchers found that the app helped to capture flare-ups and patterns in patients' long-term conditions and helped to improve the quality of face-to-face visits. This app is not yet being widely used, but shows progress in this type of more personalized medical care and can be used as a model for future applications. Another app mentioned in the article reminds patients to take their arthritis medication. And these applications have shown benefits for both clinicians and patients, but the benefits are not yet being fully harnessed.
So why do we care for health informatics? Health informatics allows for information regarding health and medicine to be readily available for access for doctors and patients, and to be accessed across different providers. This technology has allowed to identify people who are at risk of diseases and improve consultation supported by this study, as mentioned before by the Salford Hospital. This has also helped lower medical costs and errors by providing a structure on how to organize health data information more efficiently. Health informatics is also not exclusive, as it incorporates from other disciplines such as computer science and public health. Health informatics answers the question, how to design tools to improve medical care and quality.
To summarize what we have learned, the field of health informatics is an emerging area of technology that is important in streamlining the collection and storage of data in the healthcare setting. These articles demonstrate the potential benefits of health informatics for both patients and clinicians and show the importance of these systems to healthcare management